Thank you all so much for having me today. Like Dr. Smith-Hicks said, I am a former employee at Kennedy Krieger and worked in the Rett syndrome multidisciplinary clinic. And I'm so sorry I couldn't be with you all today. As some of you know, I'm expecting a baby in January, and I'm here just making sure that we keep him safely inside. Thank you for pivoting this and letting me do a virtual talk today. So today I'm going to talk to you about physical therapy goals in Rett syndrome and the benefits of aquatic therapy. And I want to spend some time talking about goals, just like Dr. Diener was saying, so that you as a family have an idea of what to look for when you're going to physical therapy and maybe some goals to keep in mind based on your individual situation. And then I want to talk a little bit about aquatic therapy, as that might be a tool that you're able to implement or ask your physical therapist about as a way to progress skills in your loved one. And I'll talk a little bit about a home-based program for aquatics and give you some resources you can take home with you. And I know Dr. Smith-Hicks has already done a wonderful job talking to you a little bit about the pathology of Rett syndrome, but in talking about the goals, I wanted to give you an overview of some of the most important things that I'm looking at. So some studies show that about 37% of individuals with Rett syndrome are not able to walk. So that does drive our goals pretty frequently. As with non-ambulatory individuals, there is a correlation in the presence of scoliosis and also a higher risk of low bone mineral density. We also think about stereotypic hand movements, like Dr. Diener just spoke to us about, and how that can impact assistive devices we're able to use for walking. We look at fluctuation in muscle tone and apraxia, and also thinking about the literature that shows that we are seeing some decline in motor functioning from about the age of 13 on. And that's something we want to keep in mind as we're making recommendations for therapies. So the literature shows that there is a social mobility decline over time and variable clinical presentations, and that can be variable from person to person and also through the lifespan, variable by age. We also know that there can be slowed progression of that decline with appropriate interventions such as physical therapy. There's a slower decline in higher functioning individuals, and sometimes we're seeing a loss of hand function over time. So then why is PT so important? So we also know that functional mobility skills can be improved upon or relearned over time, even if a skill has never been achieved, or if it's a skill that has regressed or changed due to a hospitalization or an illness. We also know that in Rett syndrome, without repetitive use of a skill or practice, those skills can be quickly lost. Early intervention is really important, that we make sure we're seeing these kids as soon as they're diagnosed, if not before, so that we can start working on maximizing those skills. Early intervention is key, and ambulation provides a protective effect against muscle contracture. We know that increased time in a rehabilitation program leads to higher quality of life in the physical functioning dimensions. And two really important things that I want to mention in terms of physical therapy and goals is that a lot of times in Rett syndrome, we think about the maintenance of functional mobility as progress. And that's very different than you might see in another diagnosis or in other children. And so it can be difficult to document that though, because
Briana,
yes.
can you try sharing your screen? I don't know which one it is, but we're not able to see. We can see the first slide, but not the others.
Oh, okay. Let me try again. All right, so I'll stop sharing and then try. Oh, sorry. Let's see.
You don't know.
Now can you see?
Yeah. Yes, but it's not. It's in presenter mode. So slideshow. Yes, awesome.
Now you can see?
Yes, thank you.
Okay, good. Just let me know if when I change it, it doesn't stay there, if it doesn't go. Okay. So we want to think about how we're writing these goals to show that there is progress, even if it may be that over a 6-month time, an individual is maintaining their ability to walk, that's progress. And that's something that we want to make sure we're seeing. And it's important as a physical therapist that I document appropriately the changes that I'm seeing and also the changes that you're seeing as a caregiver at home, making sure that that we're showing that maintenance of function as progress, so that we can continue insurance coverage there. Did the slide change to goals?
We're still on that goal. Why is PT important?
Okay. Let's see. Let me try one more thing, and then we will. I don't know why it's not working.
To advance it?
Yeah.
So,
Yay.
I'm gonna let it change. I know, but I'm gonna have to go out every single time. So I may just have to do it in presenter mode. Is that really distracting if it's in presenter mode?
No, that'll be fine. Thank you.
Okay. Okay, we'll do it this way. Thank you. Okay, so like I said, we want to think about maintenance of functional skills over time. Although we are always working on progressing those skills, sometimes it takes a little bit longer, and we just want to make sure that we're documenting appropriately and writing goals appropriately in order to make sure we can keep those therapy services going. So when I think about specific goals for physical therapy, I first want to think about what the patient and the caregiver have for goals. And that could be something that would be helpful for them at home, whether it's going up and down stairs that are in the house, going up and down a ramp to get into the home, whether it's walking from the bedroom to the bathroom, and also thinking about assistive devices that are best for safety and for function. And I always want to be training the caregiver so that they can most effectively um, and easily take care of their loved one. So realistic goals are maintaining a current level of function or returning to a previous level of function. And I'm thinking about that specifically following an illness or hospitalization, as we often see some decline in function after the event. And again, if I'm seeing someone who is newly diagnosed, those goals are going to look a little bit different than they are in someone who has already started ambulating or has reached a certain level of function throughout their lifespan. So in those younger patients, I'm always thinking about maximizing that level of function. And then as the individual starts to age, I'm thinking about maintaining function and progressing to being functional in their community and their environment, and those patient and caregiver goals. I'm always looking at the individual and what impairments they have that we need to manage, whether it's ambulation, is it contracture management, is it positioning and scoliosis prevention, and again, what functional requirements they have. So 3 really important points that are bolded at the bottom go along with what we were just talking about in terms of that goal writing. So one thing I'm always thinking about is balancing this ongoing care and skilled therapy, meaning your loved one is coming to therapy 1 time a week, 2 times a week for the long term, versus what we call skilled monitoring with community activities, which would mean that maybe your loved one is going to the YMCA for an aquatics program, and they're coming to see me maybe every 3 months, every 6 months to check in and see how they're doing. And there is a certain level of balance there between those 2 things. And I think it's important, first and foremost, that all of these individuals are monitored because we want to make sure we're looking for any sign of regression. We always want to be maximizing function and making sure that equipment, orthotics, anything like that is well taken care of. But there's also a time that this skilled therapy, where you're coming to therapy frequently, is really necessary. And for each individual, that time frame looks different. And you can talk with your physical therapist about what that might look like and what community activities might be the most helpful as you are going in and out of this skilled therapy. Research has also shown that The best opportunity for participation is if an intervention is performed in the home. And by that, I mean that these individuals want to be making a meaningful contribution at home. And that looks different for everyone. Maybe they want to be independent in their mobility. Maybe it's being able to sit down at the dinner table with your family comfortably. Maybe it's participating in a movie night with family. It could be anything that's important, but making sure that the goals we're working on in therapy and the impairments that we're working on are translating into a meaningful activity at home. And every program is individualized. It has to be focused on your loved one and their specific impairments and making sure that we are targeting what's important to you. So I do want to just go over some equipment that you might see or hear of that your loved one might be prescribed and some things you might work on in physical therapy. So the first one is a standing frame, which you see in the top right corner here. And those are prescribed mostly for standing with this perfect posture, full weight bearing. And that's so important for bone mineral density, for strengthening, for circulation, GI, movement, and participation. In the stander, a lot of times you'll see individuals be able to participate in activities at school, be able to stand at a kitchen counter for an activity. And again, they're getting this full weight bearing through their body in a perfect posture. So you'll see their knees are fully supported, they're standing upright. There's sometimes laterals on each side of the trunk to help with the back posture for scoliosis. And so that's a really great way to get a nice stretch on all the muscles and to get this really good posture. And that kind of goes along with the gait trainers that you see right below that, the green gait trainer there. And those are sometimes used to help with support for walking. And you'll often see them have a pelvic support underneath and also sometimes a trunk support that comes around right under the armpits. And in some individuals, this is appropriate and a great way to get some movement in the legs and strengthening. I always tend to caution with these devices because of the amount of weight bearing and the posture that you might see. So we know that a lot of times individuals with Rett syndrome tend to lean into whatever support is provided. And it's important as we're practicing these skills and really working on progress that we're giving as little support as possible that is safe. And sometimes in the gait trainers, with that pelvic support especially, the individuals tend to kind of sit down and they're really leaning on that trunk support or they're leaning on that a body weight support underneath. And so it's also not promoting a good posture and standing for the bone mineral density for muscle and bone development and growth. So I often look at that on a case by case basis and see how the individual does in the device. And sometimes, like with the Rift and Pacer, you can take off that trunk support, you can take off the pelvic support, and it does give a really great way to give some ambulation to some of these individuals. So just something to discuss with your physical therapist and really think about, especially if you have to decide between a stander and a gait trainer for insurance coverage. A lot of times I do recommend the stander because it's giving you that perfect posture and standing. Walkers are sometimes used, often depending on upper extremity function. We really need the individual to be able to hold on to the device. And we'll use things like elbow immobilizer splints, or sometimes we can even use some fabrifoam wrapping around the hand to help hold on to the walker. But that's a good option if it's something that you can try with your physical therapist. And I wanted to talk a little bit about bracing that you might hear about. So I often prescribe night splints, which are in the bottom left part of the screen that are stretching splints. And as Dr. Smith-Hicks talked about, contractures are something that we really want to watch out for, especially as that low tone in these individuals starts to progress into more high tone. We want to make sure that we're keeping a good posture at the feet and the legs, especially so that we can preserve that walking ability over time. So the night splints can be used to provide a low load and long time stretch over the nighttime. And you can adjust the amount of stretch on these so that we're not causing any discomfort And we really monitor the skin to make sure that there are no issues with those. So for daytime bracing, that's when the recommendations become a little bit more variable. And I tend to see and prescribe this more in individuals who are newly diagnosed and still have that low tone. Because at that point, we start to see the feet kind of turn in. And over time, as these individuals are standing and learning to walk and move, that abnormal pull on the muscle and the bones continues as they're growing. And then we end up with some abnormal postures at the feet that can prevent ambulation in the future. So we usually prescribe what are called SMOs, those little short braces that come right above the malleoli of the foot. There are times when I prescribe a higher brace, certainly to give more stability. But that is more common, I think, in younger individuals with that low tone. As the individuals get older or become more high tone, daytime bracing is really variable for me, whether or not I recommend it, and it's based on how it affects their walking. Sometimes these individuals develop really good postural reactions and really great walking skills in the position that their feet are in while they're standing. And if we go in and try to brace and correct everything, they're much more resistant to moving and tend to lose their balance more easily. So I'm always making sure that I'm balancing maintaining that posture at their foot with maintaining their functional ability to walk. And so the nighttime bracing is sometimes more effective in those individuals so that we're not preventing them from walking during the day. Other things that you might see in therapy are sitting to standing, like you see in this bottom picture here. This individual is practicing standing with her therapist with just a little bit of support to get that good weight bearing through their legs and probably some strengthening going from sitting to standing. Sometimes we use obstacles to help with coordination and not apraxia, so they can work on balance as they're walking. And if I'm working on something like going up and down steps in the home, I might start with varying levels of height so that I can get the strengthening progression as we're going forward into working up to the full stairs in the home. So this morning, Paige talked a little bit about the importance of transition planning and going from childhood to adulthood care in Rett syndrome. And I think that's such an important topic, especially when we think about physical therapy through the lifespan. So in transition planning, I think about day programs, respite care, and the importance of this multidisciplinary team to really monitor these individuals over time and making sure that we're monitoring their needs and taking care of things as they come through the lifespan. Again, the importance of resistance activities and supported standing to slow the decline of osteoporosis and maybe prevent that, monitoring any changes in equipment that are needed, and making sure that the individuals continue to participate in their activities of daily living and be as functional as possible in their environment. And making sure absolutely that we're following up post-illness and hospitalization. And although, like I said, I encourage that follow-up all the time, just every 3 months, every 6 months, if they're not in weekly therapy, but especially if there's any illness or hospitalization. And community wellness is also really important to continue to facilitate that work outside of physical therapy, which is why I want to focus a little bit on aquatics. So why aquatics? It's a safe environment, it's enjoyable, and it gives these individuals a really great freedom of movement and providing an opportunity for uptime, meaning standing, walking, with a lot more freedom than they might have on land. It's an alternative method of skills practice and provides an opportunity to work on postural control and tone reduction. So there are 4 properties of water that help the aquatic environment be so effective. So the first one is buoyancy, and that gives us a greater independence with movement in the water. And based on the height of the water, it's taking away some level of weight bearing in the body, which makes it easier to stand, easier to move, and also gives us a feeling of safety as a caregiver when we're in that environment. The viscosity of water allows us to work on postural control and balance, and the natural resistance and hydrostatic pressure in the water gives us strengthening and progressive overload without any added weight, without any significant risk that we might have on land, and gives that added level of stability and safety. It aids in strengthening the respiratory muscles and increases blood flow. And then the thermal properties of water, not necessarily as hot as like a hot tub, but if you can get into a therapy pool that has a little bit of a higher temperature than maybe a community pool, that's when we can start working on tone reduction, relaxation, and comfort. So literature suggests that aquatic therapy can reduce stereotypical movements, improve communication, have a positive effect on social interaction, reduce anxiety, improve balance, and improve motor function, somewhat because of the sensory experience of being in the water. So how much is necessary to get those effects that I just spoke about? There's some variable levels of evidence ranging from 45 to 60 minutes a day to get improvements in functional mobility. Another study showed improvements in 2 times a week of aquatic therapy to help with walking balance, anxiety. And then another study showed similar improvements in a program 3 times a week for 30 minutes for 10 months that included walking, rocking, kicking, and cycling. Some things to consider if you are starting an aquatic program. I would recommend starting with a physical therapist or someone who has experience working with this population in the water so that you can get a nice solid program and ideas to work on at home. But this is also something that you can do at a community pool like the YMCA, or if you have a pool at home, because typically just being in the water is some of those water properties are giving you that input without having to have a true skilled program necessarily. I always recommend slowly introducing the aquatic environment, especially if this is a new experience. We want it to be fun, we want it to be enjoyable. So maybe you just start with sitting in the pool some, or taking a couple steps, or just standing in the water to get comfortable. Introduce new equipment with support as needed and a pace that's comfortable. And just being aware that land-based activities that you're working on in physical therapy might not generalize to what's happening in the pool and vice versa. Because of those properties of water, we often see these individuals be able to do a lot in the pool that maybe they're not able to do independently on land. So we want to make sure that our goals and our expectations of these individuals is appropriate in the pool and maybe different than what we're seeing on land. So other things to think about, just making it fun. Again, helping these individuals feel safe, feel comfortable, and for it to be something novel and enjoyable for them. Some things to think about working on would be sitting on a float to activate core muscles, similar to what you see here. And I do have some specific examples of equipment that you might think about too in a future slide. Using ankle weights to promote weight bearing. So especially if you're in a water level that's higher, we want to make sure that the individual is actually weight bearing and getting some good body weight support, as opposed to kind of floating in the pool and not getting that good input through their lower extremities. If you're using a pool that has a concrete floor or a rough surface, you might use water shoes or socks just to help with that sensory input. Sitting with weight shifts during play or singing. And then again, just general movement in the pool is requiring these novel balance reactions that can improve body awareness and stability. Some other safety things to think about: having a towel ready when you leave the pool to retain that body heat is really important. Just making sure you're prepared and have a change of clothes ready as well. Hydrate and rest after being in the pool. It's very dehydrating, and also you're working really your whole body when you're in the pool, as opposed to focusing on certain muscle groups that we can do on land. So making sure that you're starting slow, you're monitoring how your loved one's doing and changing things appropriately based on that. And always doing skin checks, especially again if you're on a rough surface and they're not wearing any socks or water shoes. So here's some examples of equipment that you might think about. Pool noodles are great to use as either sitting floats, or if you have your loved one laying on their back in the pool, you can use these float under their arms, under their hips, knees, and ankles to help maintain that floating feeling if you're working on weight bearing, or sorry, if you're working on tone reduction in the pool. There also on the market are these noodle sling chairs, and just being in the water, sitting with trunk support is a lot more challenging than sitting with trunk support on land. So even just by your loved one kind of relaxing in the pool in this chair, they're having to work those postural control muscles to stay upright. The next picture is a water walker, and these are flotation devices with some styrofoam in them that allow your loved one to have some stability when they're walking, but yet doesn't provide too much support. So they're still having to use core muscles, postural stability muscles, and weight bearing to walk, but it does give a sense of safety for you as a caregiver and some additional support for them. Floating cuffs on the legs can help with strengthening, so that if your loved one is standing, they really have to work against that floating to maintain the standing, or the ankle weights that can help weight the body down and help with more weight bearing. The 4 floats on the bottom are all neck floats, and we use all of these in the pool, and they're all safe and effective. I just find that each individual has a preference and one that works better for them. So if you're doing this tone reduction in a warmer pool, it might be helpful to try some of these out to help make sure that you're protecting breathing and you're protecting the neck as they're sitting in the water. I did a full aquatics presentation as a Facebook Live back during COVID, I think in 2020, with Rett syndrome, and that presentation is on YouTube. And I have more specific examples and videos. Some of the families were so gracious in sharing their loved ones and their pools to get some video footage. So I encourage you to look that up on YouTube if you want some more specific ideas. And then here are some websites with some pool equipment that I just spoke about, and also a place to buy swim diapers, which sometimes the YMCA or other community pools would require. The YMCAs around usually have a special needs aquatics program, and that's a great place to start. You might just call your local facility and see what they offer. And my email address is here, brianaczerwinski@gmail.com. If you have any specific questions or are looking for resources in your area, please don't hesitate to reach out. I'm happy to speak to you more about that. So thank you all so much again for having me. And at the end, I'm happy to take any questions, or please feel free to email me about anything.